Yes, so my name is Kelly Tsang. I am a biomaterials engineer. I graduated from a joint PhD between Monash University, the CSIRO, and the CRC for polymers with Professor John Forsyth Helmertisson and Richard Evans. And in the last 5 years, I've moved to Canberra to join the Therapeutic Goods Administration, also known as the TGA. I work in the area of medical devices, and in the last couple of years, I've held different positions in both the laboratories for the testing program, in the pre-market assessments and approvals area, and now working in the ongoing surveillance of what we call post-market reviews area, where we look at medical devices that are being supplied in Australian markets. In this role, I lead a team of diverse investigators with different backgrounds. We undertake the reviews to consider and evaluate any emerging risk of product safety and performance of medical devices. So in terms of, I guess, the work that I'm most proud of, being in the TGA through the pandemic is definitely a highlight. I think in this time, each sector faces unique challenges in making our world better through the COVID times, but we also come to realize how interdependent we are with one another. Being in the public service in this time means that, especially in a mostly health-related situation, it does mean that we get to see that much closer the impact of our work with our day-to-day lives. And in our department and with different parts of government, we've actually smashed a lot of silos, worked really cooperatively across government, and working very closely also with the state and territories health departments to look at the emerging data, trying to strategize across different situations in ways that we haven't done before. We're treading new grounds and bringing a lot of very positive change to bring about that benefits to all Australians in the way that we work and the work that we do. We also work very closely in this time with our industry colleagues to ensure that the supply of quality products in the market remains accessible. So, for example, we reviewed and tested over 2,000 different face masks and respirators to ensure that they're fit for purpose for our health workers who rely on them each day they're going to work. We're publishing more guidance material for industry. We liaise with different test labs around the world, and we also meet up with international regulators as well to discuss and exchange ideas to bring about improvements. In the COVID-19 test space, our team continues to monitor the COVID-19 test kits. As we know, the virus has multiple variants that are emerging. So with each variant, we are continuing to work with the manufacturer to look at their evidence and to provide the updates via our web pages to the general public. It's been really heartening to see people come back and refer to the TGA website for information and to confirm whether and do the due diligence when they do the research in purchasing test kits. And they're also helping spread a lot of good information as well. So that's been heartening. So in our role at the TGA, we still work at the edges of known knowledge. So even though it's not a research-based role, a lot of times we're still trying to look at gaps in the data and looking at risk where there's not a lot of perhaps evidence-based, or the evidence is still emerging and they're still in the process of being written and some of those tests being undertaken in the labs. So quite often, for example, we're looking at biocompatibility or long-term safety risk of, for example, a particular material in an implant or maybe an aging device that still interface with the patient in some way. So currently, for example, I'm looking at the toxicology risk of some of the polyurethane material when it's susceptible to aging and emission of volatile organic compounds. When I'm looking at biocompatibility, a lot of the research is about the implant, but it's not about the risk of harmful gases when it starts to break down over time. So that's an area that we're trying to go, well, how can we use the information out there in the literature to try and connect with the potential harm to a patient? And aside from that as well, our work is quite reactive. We're always looking at emerging risk as it happens, but that's usually because an incident's already occurred and the patients have reported an incident to us. We're trying to also look at ways in which we can be more proactive in looking at the data that we have, trying to look at those trends that are rising with particular groups of patients or groups of medical devices, so we can take action a little earlier and do that signal analysis, probably through some of the growing data analytics area, to try and look at potential adverse events and trying to work out correlations and determine the causal relationships. And to do that also would mean that we might be able to partner a lot with the research sector as well to try and confirm some of our initial hypotheses as well. So my involvement with the ASBTE started when I was a student. I worked closely with many active committee members during my time, both when I was undergrad and also when I was working at CSIRO. And for the last couple of years, I've been a representative and liaison officer with the Science Technology Australia, which is a peak body of Australian science peak bodies. So it's representing a collective voice of science across Australia, and also engaging as the science sector with government, with public policy, and encouraging more of evidence-based decision making. It is great to know that we as material scientists and tissue engineers aren't we are part of a greater scientific community who face similar challenges with things like budgets, with tenure, the funding to positions, career opportunities, representation, diversity, job security, and the relevance to Australian industry and all of the pressures that we know so well. Every other sector is also, every other research-based group is also facing similar pressures. So it's good to be able to be part of that and be part of that critical mass of voices for Parliament and parliamentarians. More broadly in the ASBTE, although I'm not in a bench research space, I believe that wearing my public service hat is important as representation also to provide a different perspective. Our research area particularly is really striving towards innovation, striving towards development and commercialization as well in a highly regulated field. There is a lot to learn and navigate in this field, and each day I'm still learning so much about regulations and better practices and what researchers and commercial entities can do. So I believe anyone interested in going bench to bedside should arm themselves with as much knowledge they can, even in the very early concepts, experimental design and development stage, just to give you guys the best chance possible. So part of it is staying involved so I can give back and be a conduit to help answer some of the common questions and perhaps help you save a little bit of time. And also just in general, public service is a great career opportunity. I first heard about working at the TGA from one of the career panels at the ASBTE conferences. And likewise, when I come over and meet students, when I have a poster, it's great to speak to the students and talk to them about what I do, about the career opportunities at both the TGA and in the medical device sector. So I think it's one of the good ways that the society brings of the young minds together to look at the different opportunities we have. So things that people might be surprised about me. Something interesting is that I found there are parallels between my father and me in our life circumstances. So when my father was around 14, he moved across with his sister from Macau to Hong Kong to look at new opportunities for education, for work. And similarly, myself and my sister, when I was about 14, we also moved to Australia and in pursuit of new education opportunities and work. So I thought that's something that's quite interesting parallels across generations. And of course, I love being in Australia. It's exposed me to, blend in both my cultures from Hong Kong, where already East meets West, and then being in Australia as well. And I think in some ways that has given me additional perspective and appreciation on many things. Right, so if I weren't in the field of biomaterials and tissue engineering, and if raw talent is not a barrier, I would love to be a Broadway composer and work in show business. I guess there are some parallels you can draw between academia, in that you spend years away, working away on your magnum opus and hope that one day it thrusts you into the spotlight and that you get to do it over again and again and again. But at the same time, music is universal. For me, it's a great creative outlet. And besides, I think there's a whole lot more money potentially to be found in entertainment than in science for now. So the coffee that I'm drinking, well, one of the promises that I made to myself when I started my PhD was that I would not be entirely dependent on coffee. And to this day, I haven't had more than a sip of two of coffee. So I'm into my green teas and quite often a nice jasmine blend. What I'm drinking now, this is a Shincha or a new tea. It's got a vanilla infusion and it's quite fragrant. I'm also quite partial to a Chinese dragon well tea, or what they call longjing. I actually call it, instead of drinking tea, you actually eat it because you're meant to eat the tender leaves as well. They are quite tender and fragrant and packed with far more oxidants, antioxidants, I should say, than just drinking the tea.